Yes, yes, good point. So, for all of you all that are attending today, we're going to be entering you into a giveaway. We sent out an email with the headphones that are going to be, you can be entered into the drawing for those headphones. And you'll want to download the FCC Cares app onto any smartphone for free. And once we have the presentations going, and once we have the link to the recording up and posted onto our SharePoint site, we will then open up the giveaway on the app so that you can go onto the app and attest that you did join the presentation or listen to the recording, and you can be entered in for that giveaway. And here's the QR code so you can scan it on the screen and download that app. But just a reminder, it won't be opened up to enter until after we have the recording link. So we'll send that out to you guys to let you know when it's available.
Awesome. Thank you for doing that. So I'm gonna leave this up here for just a quick minute, just so that way folks can go ahead and get their phones out, go ahead and scan the QR code, and then we'll talk into a little bit more on the agenda. So the thing, just to really kind of level set for everybody, what we want to do in our time together is just make this very conversational. We want you to feel very comfortable about what a health savings account is. We want you to understand how it coincides with a high deductible health plan, and how if you are considering an HSA plan, you do have to be enrolled in that high deductible health plan. So I think with that, what I'll do is hopefully everybody's good with the QR code. Real quick, if you have a question, feel free to drop them into the chat. We've got our team here, Shar and Anna, are going to be helping out. So we want to make sure that we're getting your questions answered. And again, the bottom line to all of this is that we want to make sure that you feel very comfortable in understanding what a health savings account is, and then how it works within the high deductible health plan. So that being said, we'll get this going. And again, these are the key things that we're going to be going through, talking about what a high deductible health plan is, what an HSA is, health savings account. I'm going to apologize up front. So as Vanessa had mentioned, so we are your benefits consultants, and within the healthcare industry, we absolutely love acronyms. And so anytime I see an acronym, I will really do my best to take a step back and just explain what that is. So that's where you're going to see HDHP, HSAs, all these lovely things that we love to throw out there. So anyway, those are what you're going to see. Talking about, basically what is an eligible HSA expense versus a non-eligible, and really just kind of run through the key components of what an HSA is and really the benefits to it. So those are our goals for today that we want to get through. And again, if you have questions, feel free to drop them into the chat. We want to be very respectful of your time, and then also just any comments and questions and concerns that you have. So what is a high deductible health plan? So this is a plan that you have available through Family Care. So you have both a high deductible health plan and then also a PPO plan. So as I mentioned before, with this health savings account, if you are interested in this, you do have to enroll in this high deductible health plan. As you can see here, the way that it works out, essentially it is a matter of understanding that if I'm covering, let's just talk about this right now for me covering myself. If I am covering myself, if I am underneath the high deductible health plan, I am responsible for the first $3,300. That is my deductible. After that, you see in the list below where all the other services are covered at 100% thereafter. However, the one key component you'll see down at the bottom is going to be around the pharmacy. So any of your prescriptions after the deductible is met, you would be responsible then for 20%. Those dollars would all accumulate up to the out-of-pocket maximum that you see up there, the third column down, that's $6,600. So that's if it was just me as a family, or me by myself. If I was covering my family, the thing to note is that, let's say I had a family of 4, and I was going through course of the plan year. By the way, the accumulation period for this is going to be January 1 through December 31st. So please understand that these accumulations that you see over here on the right-hand side, those do reset every January 1st. So if I was covering my family, and let's say I had a situation where, well, I could even just use the current situation. I just had my knee surgery on Thursday. Let's say that through the physician, the facility, any of the other charges that are associated in along with that, I hit $3,300. So my my deductible is covered. Let's say, well, I'm going to keep with this because at our household, it is leg surgery year. So my wife just had a knee replacement. So with us being underneath the high deductible health plan, between our two surgeries, if we had our other children covered underneath our plan, between the two of us, we've met that family deductible. So once that happens, then any other services for our family, as you can see down below, are going to be covered at 100% with the exception of prescriptions. So just keep that in mind. The other thing to note too, you'll see over here on the left-hand side, we talk about the concept of GoodRx. GoodRx is a nice little program. If you want to go out and use that for, depending upon what your prescription may be, it's a nice way to get some additional discounts on your prescriptions. The one thing that you're going to want to note, though, is if you do use GoodRx for any of your prescriptions, those dollars don't accumulate toward your out-of-pocket maximum. So just kind of be heads up whenever you're utilizing that. Ideally, the goal is, depending upon what you got going on throughout the course of the plan year, you want to hit that deductible first and then be able to obtain any of those other services. One other thing to mention, and I think I'm actually probably getting ahead of myself, so I'm going to hold off on that with regards to preventive care. But the thing to note here is preventive care services are covered at 100%. So, we'll address it now. You're going to hear me address it later. This is something that's very key just to be aware of. So any of your annual checkups, any of your immunizations, things along that line that would fall underneath that preventive care category, those are going to be covered at 100%. So please keep that in mind as you're going through seeing what, really what services you have throughout the course of the year, and then kind of building into what works well for me. Okay. So these are a couple pieces with respect to the way that the plan works. All right.
Yeah, Scott, I want to add just
Yeah,
one
sure.
other thing to this. I think a lot of folks who may not currently be enrolled on the high deductible plan today, one of the big concerns is, oh, there's just no copayment. It makes me nervous to have to pay my deductible first. And just know that we'll talk through this a little bit more, but as you get used to being on this type of plan, there is money that you can put away into your health savings account. We'll be showing you premium differentials, the savings you can have just by enrolling on this plan, and even the money that Family Care Centers provides you to help offset that cost. But just I think the one big piece to be aware of is it can seem scary when you first sign up, but I promise you, over time, you'll get used to how the plan works.
Yeah, that's a great call out. And again, to your point, there's, with the preventive care covered at 100%, there's some other options and resources that are out there from a lower cost standpoint. So, we'll make sure that we address those as we go through. Okay. So let's talk about what a health savings account is. So as I mentioned before, if you are interested in setting up a health savings account, you do have to be enrolled in the high deductible health plan. So as you can see there within that first bullet point. The nice thing about it is that really the way that we currently have it structured is you can set up your health savings account, whether it be through your bank, through your credit union, talk with your financial institution and see if they have that available for you, that you can go ahead and get that set up. But those are some things just to consider as far as where you would get that type of an account set up. This is an account that is owned by you. What is really great about that is that means that if you are, working with family care centers, and then let's say you end up moving on to another opportunity, that HSA account will travel with you. So that does not stay underneath the FCC umbrella. That does move with you. So that is one thing to understand, that it is completely owned by you as the individual policyholder there. All right. The nice thing about it too is the way in which you can do the contributions. So as you can see down here below, the HSA accounts, the health savings accounts, are set up on a tax-free basis. So you are contributing these dollars on a tax-free basis into this health savings account. What's really great is that you can change up. So you want to say, hey, look, I want to do an allocation of $1,000 for the year. And then you set that up on a per pay period basis and then put that in there. And then maybe you're looking at it and saying, well, maybe I need to do a little bit more than that. Then you can go ahead and enroll or add some additional dollars in there. And then you can do that at any time in and through Dayforce. So it's really kind of a nice feature that you have and the flexibility to be able to do that. All right. A couple other things to kind of, mention with regards to, and we'll get a little bit more into the details around this as well, is with regards to what you can use those funds for. So as you can see down here below, it talks about using it for eligible medical expenses, dental expenses, and vision expenses. And again, because of the fact that you are putting those dollars into your HSA on a tax-free basis, you really get that additional savings of whatever your tax bracket may be. All right. Keep moving. Okay, so we're going to dig into a little bit more around the HSA and how it applies to you within this particular plan design for Family Care Center. So if you look here, again, the deductible on this plan, and I'm going to talk about it right now a little bit more from a perspective of a single only. So if I'm covering myself, I'm going to be, again, responsible for the first $300 or $3,300. You see down below where it talks about co-insurance and paying at 100% or 100% and then zero. So essentially that means once you've met that deductible, as I mentioned before, any of those services where you see deductible and then zero, those services are then covered at 100%. The pharmacy, again, will go ahead and have a 20% co-insurance once you've met that deductible, and those dollars will all accumulate towards the out-of-pocket maximum. So just something to be aware of there. One thing to note, and we were talking about this as a team as we were going through this, as Shar had mentioned, when you look at it and you start thinking about, might be a little nervous or concerned about, what are those costs, when I need to go to a doctor, what that's going to look like. Right now within and around the Denver area, average cost for a doctor's visit is around $170. So you can use that if you have that face-to-face visit. Some other things to consider too are the virtual options. So you have some lower no cost options there through your providers where they can have a face-to-screen visit. And sometimes those costs are going to be, about more than 50% in savings that you would have around that. So it's certain things, again, as we were talking about the ways to leverage this plan, preventive care being covered at 100%. If it is an in-person visit that you have with whether it's a doctor or with a specialist, understanding what those costs are and then how those accumulate towards your deductible. And then even understanding the resources that you have through virtual visits and things along that line. So those are some things just to kind of keep in mind. Any questions, Char? Has anything else come through that you can see in the chat? Are we doing okay?
Yeah, we did have a question. So we got asked if the spouse already has an HSA, can we contribute to the HSA? And as long as your spouse is enrolled on a high deductible plan, then yes, you can participate in the HSA through whether their employer has an HSA option. Family Care Centers has that through Thrive Pass. So you'll have that banking system available. As long as you don't contribute more than the maximum, and the IRS tends to increase those maximums each year, then you're in good shape. But I think the big key here is just to remember you have to be enrolled on a high deductible plan to contribute to the HSA.
Yeah, thank you for that. I appreciate it. Actually, that's a great segue into what we're just about ready to talk about here. So essentially, who is eligible for a health savings account? So as Shar had just mentioned, you need to be enrolled in a high deductible health plan. No other coverage, other non-high deductible health plan coverage. So there's some pieces that we'll talk about there, whether or not you're enrolled. Let's say, so basically you can be in another PPO plan, or there's some other types of products that are out there you see down here below. You can't be enrolled in Medicaid or in any of the Medicare Part A, B, or C, or D. And then with regards to the way it works, essentially the big key is, again, like Char was talking about, you've got to be enrolled into a high deductible health plan to be able to contribute to a health savings account and even be able to set that up. Okay. Who is not? So as I mentioned some other things earlier, if you are currently in a Medicaid program, you would not be eligible. If you or your spouse is enrolled in a flexible savings account, you've heard FSAs before, work a little bit different. So if you're enrolled in one of those, you are not currently eligible. Any medical expense reimbursement plans, which is not currently set up for you. You also have HRAs if you are enrolled in HRA. And then I think the biggest thing really that I've seen in my experience is on that military, where you have folks that do have TRICARE. If you are currently enrolled in TRICARE, then you would also not be HSA eligible. So those are some things to really kind of be thinking about with regards to whether or not this is a fit. I had mentioned earlier about the FSA on that last slide, and this is where I usually see a lot of people get confused. What's the difference between a flexible spending account and a high or a health savings account? And this is one of the biggest keys. The health savings account, these are funds, as I mentioned before, because it's an individually owned account. Those funds roll over with you year after year after year. I had a colleague that actually kind of labeled an HSA as like, consider it like a medical 401k plan, right? So you can sock those dollars away year after year, and those things grow and accumulate. And then that way you can use those for either current medical expenses or future medical expenses. There's a triple tax benefit, and we'll touch on that here a little bit later. Really just the big key there is, again, doing these contributions from a pre-tax basis. As we mentioned before, you can elect the flexible spending account if you're contributing to an HSA. There is a limited purpose FSA that is available if you are in an HSA, and that would be for qualified medical or expenses such as dental, vision, and ortho expenses and things like that. So the medical would not be a part of that limited purpose FSA. And then you also have some subject to the IRS rules. Really, the biggest thing to be thinking about when you have this type of an account is keep your receipts. So whether it's, for your medical expense, dental, vision, whatever it may be, anytime that you are going to go ahead and use those and submit that to your HSA for reimbursement, you are going to want to make sure that you keep a copy of those receipts. So you just want to have all that information handy if in case you ever get audited with regards to utilizing your HSA account. So some things to understand. Okay. What are some of the benefits? As I mentioned before, so again, this is an individually owned account. It's going to travel with you. There is no use it or lose it like you currently see underneath a flexible spending account. So it really makes it nice. You can use it for, again, as I mentioned, current medical expenses, or if you want to just continue to let those dollars accumulate year after year after year, you're going to be able to do that. So it's a really nice feature there. So it becomes that nice tax savings account. Again, as we mentioned, those funds that go in are on a pre-tax basis. You've heard me talk about them being individually owned. So if you do end up leaving family care centers and going to another opportunity, those dollars would travel with you. So some things to be aware of there from that perspective. I don't think we haven't talked about this yet, but what you would normally see is that when it comes down to your overall premiums, that your high deductible health plans are going to be typically lower from an overall premium perspective than say like the other PPO plan that is currently offered. So that's normal. Essentially what you see is, think of it this way. The way that the plans work is think of it from a cost share perspective. The high deductible health plan, you have to meet the $3,300, again, talking about this from an individual perspective. You're meeting that first because of the fact that you're going ahead and taking on that responsibility of the first $3,300 versus on a PPO plan where, say, you go to a doctor's office and it's a $20 copay, or if it's a specialist and it's a $50 copay or whatever that may be. Again, it's lower out of pocket at the time of service underneath the PPO plan. So those plans tend to have a higher premium associated with them. Whereas on those high deductible health plans, because you are basically taking care of those dollars up front, all accumulating towards your deductible and your out of pocket, those are going to end up having a lower overall premium from that perspective. So that's some things that you will typically see whenever you have a high deductible health plan and a PPO side by side. All right. I just saw a question come up, Char, on if
Yes,
FCC has FSA.
FCC does have an FSA option. So if you are enrolled on the high deductible health plan, obviously you can contribute to an HSA. There are options. You can still participate in the FSA, as Scott mentioned, that limited FSA for dental and vision services. But remember, with the health savings account, you can reimburse yourself for medical, dental, and vision expenses. So it might be easier to administer for yourself just to put funds in that HSA.
Thank you. Down here at the bottom, so a couple of things, kind of like we were talking about with regards to how to make those dollars grow as well. So you do have the ability to invest those HSA funds into stocks, bonds, mutual funds, things along that line, and taking advantage of those types of vehicles to help those dollars grow for future medical expenses, should you choose to do that. And then at age 8 or 65, basically it's just those dollars become available to you without any excess tax liability. So in other words, you have that opportunity to be able to use those funds for really a whole lot of different types of expenses. You can see where it says funds used for non-qualified expenses will be subject to an income tax, but when it comes down to using it for any of your other types of services, you're going to have full access to that all those funds. So it's really a nice feature once you hit into that 65 range. All right.
And I think just one more important note here. The thing with being on Medicare, it's not that you can't use the funds that you've saved up over the years into your HSA. Just remember, once you're enrolled in Medicare, you won't able to contribute anymore on a pre-tax basis. I think sometimes that gets a little confusing, but those dollars are yours to use.
So we've talked just a little bit on the tax advantages. You had seen earlier in the slides, we were talking about the triple tax advantage here, and this is really what it boils down to. So as we talked about earlier, so payroll contributions to an HSA are not taxed. You have the opportunity to gain interest on those earnings and grow those tax-free. So again, really nice feature. And then the distribution for the qualified medical expenses are also tax-free. So again, think a bit of the fact that you are basically saving whatever your tax bracket is on any of your particular qualified expenses, medical, dental, vision. So it's just that nice little feature with regards to these. And again, we talked a little bit more to those dollars just will continue to accumulate. So depending upon how you invest those, it really is a nice opportunity to grow that little bit of a nest egg for you from a medical expense perspective. So Shar had touched on there are certain limits that are applied to the health savings account from a contribution standpoint. This is what your current limits are over here onto the left. You see where it talks about from a self only, if you're just employee only, you can contribute up to $4,300 for the year. There is a FCC contribution as well of $300. Excuse me, you can see how it also increases depending upon what tier coverage you go through. For any of the individuals that are 55 or older, they do have what's called a catch-up contribution each year, and that is an additional $1,000 that can be contributed to your HSA account. So just some things to be thinking about as you're going through, looking to see whether or not this is a good fit for you. Anything in particular, Shar, to add in on that?
I think the only other thing to add here is you can't contribute more than $4,300. So for example, if you're on an individual plan, FCC is giving you $300, you're going to be setting your contributions to max out at $4,000. Just be aware that employer and employee dollar goes into the bucket to satisfy that limit. Just be aware of that.
Yeah, great point. Great point.
And it is per year. Yes.
Yes. Yep. Just saw that. Okay. So this is really, a nice illustration as far as what the savings are to help you fund your HSA. I'm going to leave this up here for just a minute in case you want to take a picture of it. I think this is just a nice resource for you to be able to see, what your premiums are for both the HSA, and then you also see the PPO as well in there. So we'll just kind of take a minute.
And while you're looking at that too, I think one thing to just keep in mind, if you are currently on the PPO plan, you move to a high deductible plan, that savings that you are going to get in premium dollars, you could use that to fund your HSA and not be out any additional costs. So something to be aware of. I know that they've got the cost savings highlighted in green here below for you to get an idea of what that would look like on your per paycheck contribution. But I think with that and the money that Family Care Centers contributes, that's easy money that you can save.
Right. I think one other thing too, so that's a great point, Shar. I think one thing to also remind folks is let's say you were on that PPO plan, or actually let me reverse that. Let's say you're on the high deductible health plan, and then you make the decision, let's say you want to move over to the PPO plan for the 2025 plan year. Any of those HSA dollars that you've accumulated so far, you can still use those for qualified medical expenses. The thing that you have to remember is that you can no longer contribute to your HSA. So you can still use those funds. It's just the contribution model that goes away. So just kind of be aware of that. It's not one of those things where it's like, oh, well, I went from the high deductible health plan over to a PPO. Now I can't do anything with that. It's like you still will be able to use those dollars towards qualified medical expenses. And so let's show you a couple of things of what that looks like. So these are examples of eligible expenses that you could use your health savings account dollars for. So whether it's chiropractic, dental care, again, glasses, acupuncture, things along that line. Down in the bottom left, I'm going to hold this here for just a minute too. There is a website, it's called the HSA store, and you can go out there. Everything that you will see on that website is going to be an HSA eligible expense. It's amazing to me how this website continues to grow and the amount of different types of things that you can get out there, whether it's Band-Aids, you see you have insulin on here as well. But you could see Band-Aids, different medicines, cough medicines, cold medicines, things along that line that would end up being a qualified expense that you can use that too. So this is a fantastic resource. I have used this a number of times over the years based upon the plan designs that I've been enrolled in. And it really is, it's really great to see. The nice thing is that you can actually preload your HSA, your debit card that you're going to get into their site, and then everything will ping off of that particular that debit card. And then obviously you'll also have the receipts, so then that way you can keep that information handy should you have to go through any type of an audit. But again, just knowing that you have a site that's dedicated to qualified medical expenses that are available to you. So it's a really neat feature that's out there as well. One thing I do want to touch on before I leave this, so we were actually talked about this on the team, and I apologize, I should have addressed this sooner. Non-qualified expenses. So you see down here below where we're talking about toothbrush, toothpaste, cosmetic procedures. Those are probably one of the biggest questions we get when it comes to whether or not these funds are eligible, and they are not for any cosmetic procedures. Those are not considered a qualified medical expense. Funeral expenses, childcare, those are some other ones as well that do not fall underneath that non-qualified expense category. All right. So as we mentioned, really what we want to try and do is make sure that you feel comfortable in understanding what the health savings account is, understanding that it has to be married up with a high deductible health plan, and then really taking a look at, what exactly is a good fit, whether it's a good fit for you. So some things to consider, between the two plans. And as we mentioned earlier, underneath the high deductible health plan, again, just talked about it, single coverage, you basically have to hit that $3,300 deductible. Then the plan pays 100%. The only caveat to that is going to be on your pharmacy, and that is basically 20% after deductible. And then those all accumulate towards your out-of-pocket. The other thing too to be thinking about is really, understanding your network, understanding your in-network providers, making sure you leverage the network as much as you possibly can. And just whether it's that or in also using virtual and any virtual resources that you may have as well. So just kind of understanding those mechanics of the plan. The other thing too, you're looking at the PPO, again, at time of service, what are those costs for me? Is it copay for doctor's visit? Is it copay for specialist? Understanding that I do have services that are going to be deductible first, such as the emergency room, inpatient and outpatient services, but also when you look at the plans, and you'll see this information again when you get a chance to see the slide deck, but just comparing the two plans and understanding, what the individual deductible and out-of-pocket maximums are compared to the PPO deductible and out-of-pocket maximum, and seeing how those plan designs work and the mechanisms of each one of those. And also then realizing with the premium perspective, as we mentioned before, high deductible health plans tend to be much lower from a contribution or from a premium standpoint. Same thing that you'll see here as well. So some things to be mindful about that. As you're going through and really considering what plan works well for me, should I go for the high deductible health plan? Should I go into the PPO plan? So some things that we really try to help kind of coach up folks on is take a look at your explanation of benefits. Again, we have acronyms, which we love. So those EOBs, those explanation of benefits, are it's a good resource. Look through what you've had throughout the course of the year, see what your dollars are that you've accumulated. Be thinking about any upcoming procedures that you may have. Like I said, for our family, it was knee surgery year. So we took a look at that and tried to make what made the most sense from that perspective. Prescription drug costs, if you are on a monthly prescription, and taking a look and see what is that cost. Does it make more sense for me to be on the high deductible health plan or for me to be on the PPO plan, depending upon what those out-of-pocket costs are at time of service, what makes most sense for me. Family planning, if you're considering, having a baby and thinking along the lines of what are those costs going to look like from the facility, from the provider, so on and so forth. So starting to tally those up and see what is that going to look like. As we mentioned before, you have preventive care. The nice thing is, at least on preventive care, for both plans, for your high deductible health plan and for your PPO plan, preventive care is going to be covered at 100%. So if it's any of your annual checkups, your visit, your immunizations, any of your age appropriate cancer screenings, please understand those are going to be covered at 100%. So those are some really great features per plan. So if that's something that where you're going to just, you're going to utilize, take a look at that, and how that works within the mechanisms of your plans. Dayforce has a benefit decision support tool, which is really cool. So you can really go out there and start to plug in some information and see, based upon what I know currently, and then what I also see coming down the pike, what makes the most sense for me on this. This is a great tool. I'll be honest with you, we were talking about this as a team. I have had more people ask about if there are any tools that are available like this, and the fact that you guys have one is outstanding. So please leverage that. Go in there, take a look around, plug in the information, and then see what plan works well for you and for your family. All right.
Hey, Scott, one
Yeah,
other
sure.
thing to add here. I've seen this come up quite a bit when it comes to preventive care. As Scott mentioned, yes, it's covered at 100%. But if you go to your doctor and you have the flu, but you're also getting your wellness annual physical, beware, because your doc may not bill you as a wellness visit anymore. They'll bill you for coming in for the flu, and then that 100% coverage goes away. So just something to be mindful of when you go in and see your doctor and get those wellness exams done.
That's such a great point. It's the whole dreaded, is there anything else I can help you with question? And the minute you say, yeah, I have the flu or my elbow hurts, that changes it from that preventive care to then a regular office visit. So that's such a great point. That is such a great point. Oh, yes, we get that quite a bit. Open enrollment reminders. Vanessa, anything in particular you want to chime in on with regards to these guys? You have several different resources that you can reach out to. You do have your Ask Charlie team. So even though you have the benefit resource tool, which is great in Dayforce, you also have Ask Charlie. It's a group of IMA employees that is there for you to leverage anytime that you want and ask questions about the plan and really kind of walk through even just determining which one works well for you. As I mentioned before, the benefit decision tool. And then on the open enrollment, you do have an active open enrollment this year, so it is not a passive. So you are going to want to make sure that you're making elections going into this 2025 plan year. So Vanessa, anything else we want to add around OE?
Yeah, just really quickly, the Ask Charlie is new for our team, or newer. We were rolling it out earlier this year, but really during open enrollment, we want to make sure you guys know that that resource is there for you. If you have claims questions, or if a claim was processed incorrectly, or if you need help finding providers in the network, because we do have that Local Plus network now that's available. Any questions you guys can think of, they also will be able to help you guys walk through Dayforce. So if you have not been into Dayforce yet, we will be making our elections in Dayforce. So you'll have to log into Dayforce. You'll have to make those elections and submit it successfully. So if you get tripped up or have any questions or concerns, they'll be able to help with things like that. And then just as Scott mentioned, it is active. So it is very important for you all to understand that you must go into Dayforce and you must submit your elections. The system will default to what you currently have, but you have to hit submit in order to keep those elections. If you don't hit submit, or if you don't go into Dayforce at all, come January 1, it'll assume that you waived all of those benefits. So you'll be disenrolled or waived January 1. So we want to make sure, just to reiterate, it is active. You have to go in and do something in Dayforce for your benefits for 2025. And then also, we're here as well, myself, Faye, and Seneca, your benefits team at FCC. So we're all happy and excited and willing to help you all with any questions.
Great. Okay. Well, that is going to do it for us. We appreciate everyone's time. We're happy to hang out for a little bit. If you have any additional questions, please let us know, whether you want to come off mute or if you want to go ahead and just type your questions into the chat. But please let us know how we can help. We want to just, again, make sure that you have the information you need, that you feel very comfortable around what a high deductible health plan is, what a health savings account is, and how they work, and then what you can use those for. So just please let us know how we can help. Right?
Yeah. And just a reminder, it is recorded, so we'll post the recording out there if you want, your significant other or spouse to listen to the recording with you. If you want to encourage your coworkers to attend, we do have 3 more of these. We have 1 more in about 20 minutes, and then we have 2 more on Thursday. So encourage your coworkers, your staff to attend, just to listen in and kind of hear their options.
All right, everybody, thank you guys for your time. I hope you have a great rest of your day. And again, if you need anything, just reach out. I'm happy to help.
Yeah. Thank you, Scott, Anna, and Shar. This was wonderful. Great information.
You bet. Thanks for letting us do this.
Yes.
Seeing that number slowly trickle down.
Yeah.
Curious
I'm
if
like, I
there's
want to
anyone-
stay on just in case.
Yeah. Curious if there's anyone feeling brave that just wants to wait till the numbers go down a little bit.
Mhm. Yeah.
I'm going to sign off and run to the restroom, and then I will see you guys shortly.
Awesome. Thank
Okey-doke.
you.
I'm also going to jump off really briefly, but we'll be back on for noon.
Okay, I just saw somebody,
Pablo, would it
the
be?
OAP plan.
I'm happy to take that one, Scott, if you want me to.
Yeah, that's fine. Yeah, yeah, that's fine.
Yeah, I mean, one thing that you'll want to consider is getting onto the Cigna website and just
Mhm.
checking the network. You can get onto the website and check for your providers, even if you're not enrolled in Cigna right now. You don't have to log in or anything. You just go to Cigna.com, search your providers. You'll want to search the OAP network. That's the larger
Mhm.
Cigna network, and it is nationwide, so you can check the availability in Pueblo as well. And then Local Plus is going to be a little bit narrower compared to the OAP, but check to see if your providers, or if there's providers in and around your zip code. One thing is, if you're very dead set on your provider, or if you're seeing a specialist that you just don't want to change, you're not willing to change, that'll be something to consider, which network you're wanting to take over for January 1. But we can certainly help you look for providers if you want to contact us or contact Ask Charlie. As far as the HDHP versus the PPO, that's where you have to do a little bit of digging,
Yeah.
just kind of determine how you've utilized your plan. if that's going to continue, year after year, or if that was just kind of a one-off year for you, what you're spending on routine visits that you're going for periodically that are not considered preventative, or, if you've got, procedures coming up, things, if you're covering dependents on your plan, all things to consider. But if you want to reach out and us to schedule a one-on-one, we're also happy to do that as well.
Yeah, and Nicole, to Vanessa, just to chime in. So, Nicole, take a look and see about, looking at Parkview and where all the different facilities are for Parkview down there. I know that you also have a number of freestanding facilities through Parkview as well for like MRIs, CTs, things like that. I had worked with the county for a long, long time, so I'm familiar with that for the Pueblo area. So, and I know how big of a footprint Parkview has down there. So, take a look in there, see what's available to you. As Vanessa mentioned, seeing where your providers fall. If you are looking at certain procedures, whether it's, like I said, for us, for our surgeries and things like that, definitely recommend using some of those freestanding facilities, for any x-ray lab, even or for any outpatient surgeries as well that you have. And I know Parkview's got a number of those that are down that way as well. So you should have great coverage down there underneath that OAP as well. But just as Vanessa mentioned, look at both OAP and then the LP, just so then that way you can kind of get a feel for which one works well for you and for your family as well.
Yeah, you're
You bet.
welcome. Thanks for joining.
Enjoy your day.
Yeah. All right.
I didn't look to see how many we had.
We hit 32.
Was it? Awesome.
Yeah, awesome. 32. And then it slowly trickled down a little bit after 30 minutes, probably lunchtime and having patients scheduled. So, all right. Well, I think we could probably jump from this one and jump on to the next one, or take a break.
Okay.
I don't know.
Yeah.
Scott, are you presenting the next one?
Yeah, I think so. I've got the next one. Char has the first one on Thursday, and then I have the second one. So
perfect.
All right. We'll see you in a minute then.
All right. Sounds good. We'll see you guys.
Bye.
Bye.